Good day, everyone. Welcome to today's program of the Week Clinic. Regular host, Lisa. Today, with me in the studio is my colleague and friend, Dr. Ezekiel Nwakpa. Today's topic will be talking about cholera. Dr. Ezekiel, can we get to know you a little bit?
All right, so my name, by Ezekiel, public health physician, having good experience, public health sector. Happy to be here today with my dear friend, Dr. Lisa, to make a discussion on current topic.
Okay, can you explain what is cholera?
All right, so cholera is basically an infectious disease that is caused by bacteria known as Vibrio cholerae, and it is basically caused from contamination of food and water. So that is basically what cholera is.
What are the primary causes and risk factors of this cholera?
Okay, like I've said, cholera is caused by a bacteria, and then the risk factors include contamination of food, contamination of water, poor hygiene, poor hand washing, and also poor handling of both food and other consumption. And those are the general risk factors for contact of cholera.
How does this cholera spread?
Okay, so still from the causes, the spread of cholera is usually from one when one ingests a contaminated food or water, it goes into the mouth, and then the organism is ingested, and then when it gets into the digestive system, what they call the digestive system is the part through which food travels, and then of course the body is not able to eliminate this organism, then it will start manifesting, and then if one that have come down with the infection now handles another food or water, and another person takes it, and it begins to spread from one person to the other.
What is the commonest mode of transmission of cholera? So our viewers can be aware of that.
Okay, so the commonest mode, especially in our environment, is when we have food, and then the food is being exposed, and then has contamination from this organism. Take for instance, you have some of us that we eat roadside food, and then whoever is preparing the food already has cholera, and this person goes to the toilet, comes back, and then forgot to wash the hand, and then handles this food, and then you also go there and pick the same food, and then you consume it. That is the express way of contacting this cholera. And then also, let me also explain. Also, in some of our communities, people still drink water directly from stream. Okay, so and then if somebody is on the other end of the stream, and then he's defecating, and you are on the other end taking that same water, and you are taking it, so that water is already contaminated. So it's a fastest mode of contracting this cholera.
Okay, what are the typical symptoms viewers at home will look out for to say, I have cholera?
Okay, so the commonest symptoms for you to look out for is what we call watery diarrhea. And then in the local parlance, we call it rice water stew. So if you have somebody that is passing feces, what we call stew, that is defecating frequently, it is very watery, and then that stew looks like water mixed with rice. It's one of the commonest symptoms of cholera that you will see, and then you see this person has cholera. The other one is vomiting. Somebody is passing that white water stew and is also vomiting, and this vomiting usually comes frequently, but it's not normal for somebody to vomit 2, 3, 4 times in a day. So it's also a symptom of cholera. And also for someone that is already passing that rice water stew, vomiting, and is also complaining of abdominal pain, muscle pain. Okay, these are also signs of cholera. Most times you may not see fever because the person may not even have any sign of fever, but you are seeing watery diarrhea, vomiting, general body pain, abdominal pain, suspect cholera.
So please, how do we quickly diagnose cholera? Because you said we're talking about other forms of diarrhea diseases. So how do they distinguish between cholera and other forms of diarrhea disease?
All right, so from this symptom I've mentioned, most times you don't even need to do any lab tests to diagnose cholera. But once one presents to you and it tells you, I'm vomiting, I am stooling, it started this morning, okay, and you ask the person to describe what the stool looks like, and he's telling you that the stool looks like something that I'm seeing rise, it is hallmark diagnosis for cholera. So you don't even need to start waiting to do any laboratory test. It is diagnostic for cholera.
So what is the treatment options and how reliable are those treatments or effective are those treatments?
Okay, so for the treatment of cholera, these treatments are categorized into mild, moderate, and severe. For mild cholera is when maybe the stooling is not yet up to more than 3, 4 episodes, and then the person is mildly dehydrated. Mildly dehydrated is that the skin is just a little bit dry, so the person can be given what we call ORT. ORT is oral rehydration therapy, whereby you give somebody enough volume of water mixed with salt and sugar to take orally. That is for the mild treatment. For the moderate treatment, where somebody has lost about 50 to 75% of the body water fluid, okay, you give the person IV fluid. IV fluid means you are going to set line, okay, and you connect normal saline, Ringer's lactate for the person. These are some of the fluids we usually give in the hospital to correct. But for the severe cases where the person is already going into shock, what we call shock is when the heart can no longer pump blood because the person has lost a lot of water, electrolyte. Because if you are vomiting and you are stooling, the person is losing both water and electrolyte. In that case, it will require both IV fluid. Occasionally, you may want to give some antibiotics, even though it may not be necessary, but you want to reduce that stooling. Because if you are taking care of the bacterial organism, then you reduce the frequency of the stooling. So these are the various ways you can treat cholera. But we usually tell once somebody is vomiting, even if you are not yet sure it's cholera, please start giving that person enough fluid that contains water and sugar.
So how effective are these treatment options you just listed out?
Okay, so these treatment options that I've mentioned are very effective, provided you are able to make the right diagnosis. How do I mean? If you are able to make a diagnosis of a mild diarrhea, a mild cholera, treated by mild diarrhea, oral rehydration with fluids is enough. So it's only when you are having a severe case and you are using oral rehydration, that is only when these treatment options are not effective. But if you are able to make the right diagnosis, each of these treatment options are very, very effective, even without needing any other medications.
That is great. So how do we prevent cholera as individuals and as communities?
Okay, so just from the causes and risk factor that I've mentioned, that cholera is basically caused by poor hygiene. So the best way to prevent cholera is improved personal hygiene. How do I mean? As an individual, if you go to the toilet, either you went there to urinate or to pass physics, as you are coming out, wash your hand. If there's no water for you to wash your hand, use sanitizer and clean your hand. And it's also important that once you move, but you don't necessarily need to go to that. By mere hand shaking, before you touch anything that will go into your mouth, please wash your hand. And then for the community, there is need to provide good pipe-borne water. Now, if the government cannot provide good pipe-borne water, then even if you are fetching water from the stream, please boil this water before you drink. So as long as you are handling what goes into your mouth, because the route of cholera transmission is through the mouth, what we call fecal oral, from hand to mouth. Once you guide what goes into your mouth, you will be able to prevent cholera.
Thank you very much. So can we know the challenges? Because this is you said we're talking of pipe-borne water for government to supply. So what are the challenges in controlling cholera that we as individuals and communities will face?
Okay, so like I said, one of the challenges is availability of good pipe-borne water. So there will be need for us to have more conversation with governments, to have the political will, okay, to have adequate water supply in our communities. If we cannot have the normal regular water supply, they can dig borehole, whether it is hand borehole or the electric control borehole, they can dig it in our community. And also for us to create more awareness in our community that fetching water directly from the stream and taking it that way, okay, is a root cause of all this other contamination, not necessarily even cholera. So for us to create that awareness, so that people fetch water from their stream and then they are able to boil it before consuming it. So more awareness in the community and more discussion with the government to provide pipe-borne water
Okay, thank you, Dr. Ezekiel, for joining us today, for providing insights on cholera. Thank all our viewers for joining in, and they are the reasons why we are here. I still remember your anchor, Police B. Like, share, and subscribe to our social medias and below. We'll be seeing you next week with a new episode of another public health emergency. Thank you.